Welcome, everyone, to this episode of the REBT Advocates. Thanks for viewing. I'm Dr. Michael Edelstein. I'm a clinical psychologist in San Francisco, but also with a phone, Zoom, Skype, FaceTime practice. And we are all here gathered together because we have one thing in common, and that's REBT, Rational Emotive Behavior Therapy. Now I have my partner, Rohit Bilal, here, and also we have a guest, Tony Smith, who's going to bring up an REBT problem. Just a brief background, REBT was devised by Albert Ellis in the 50s. It was a pioneering effort in the field of psychotherapy, and it's helped people dramatically change their lives over the years. So it's probably touched over 1 million people because Albert Ellis has written over 80 books. Okay, so Tony is going to discuss an issue he's had with REBT, Rational Emotive Behavior Therapy, and then Rohit and I will join in and try to help him out. Okay, Tony, do you want to explain the problem?
Okay, so the main problem that I have, and I have an example that maybe we could run through, but the main problem that I have is the element in the writing out of the A, B, C, D, E, F is the part where I'm needing, in essence, to come up with a thought process to counteract the ABC. So typically when I've done some work in the past on this, it's coming up with something along the ideas of things like well, there's nothing in the universe that says it has to be like that way.
Tony, sorry to interrupt, but what problem are you dealing with, just to give us a context?
Okay, anxiety.
Okay, anxiety. Okay, very good, very good. So Tony was referring to A, B, C, D, E. I call that the 3-minute exercise. And this is a way you can identify your disturbed thinking, what's causing your anxiety, depression, or anger, and then uproot the irrational thinking and come up with a better perspective. So that's the A, B, C, D, E, F. Okay, Tony, please continue.
So yeah, it's the E element that I believe I'm having the greatest difficulty with. So when I have anxious thoughts about something, I'm not finding at the moment when I do the 3-minute exercise that for me on a particular issue that I've got at the moment, but on other issues as well, that I'm finding I can be very creative with my E's, but they're just not getting rid of the anxious feelings.
Okay, again, Tony, for some context for our viewers, A is the activating event about which you're disturbed. So what is your A?
Okay, so my A is I have a chance that I may have skin cancer.
Okay, very good. So that's the A, the possibility of skin cancer. And then we'll skip B for a minute and go on to C. And you had mentioned you're feeling anxious about that. Is that correct?
Very anxious, yeah.
Okay, so C is undesirable emotional consequence. So Tony at A has the possibility of skin cancer, and at C, he's feeling anxious about that. Yeah. Now it could be that there is no possibility of skin cancer, but that doesn't matter because A is the worst case scenario. In fact, correct. If Tony's A was I have skin cancer, even though no doctor told him he has it, that's fine because if you can learn not to disturb yourself about the worst case scenario, then certainly you would not disturb yourself about less. Okay, correct. So we have A and C. And what's B? What's your irrational belief about the chance of having skin cancer?
Well, you may need to help me articulate this, but I feel that my irrational belief is that without a proper diagnosis, which I haven't got yet, I've already got it. So I'm telling myself I've already got it. I'm gonna die. Um, I'm not going to be able to cope. Um, so those kind of beliefs.
Okay, so I'm going to die. I've already got it, um, and I can't cope. Those are largely situations. Uh,
Okay.
so those would be more A's. A
Okay.
would be Another A would be I've got skin cancer instead of this a
Okay.
possibility,
Yeah.
and
Okay.
I'm going to die would be another A. So we have
Okay.
some A's there. I've got it. I'm going to die,
Yeah.
and then
Okay.
you're anxious about dying of skin cancer, but it's never A that causes C. It's never your situation itself that
Yeah.
causes your emotion, but rather it's B. And B in particular is an irrational belief by which we mean a must, a should, a supposed to, a have to,
Okay.
some
Okay.
kind of demand about the
Okay.
situation. So,
Okay.
Tony,
Okay.
if we're looking for your irrational belief, it begins with I must or I must not or I should or I should not something. So
Okay.
how would you finish that sentence?
Okay. So I must know now whether I have skin cancer or not.
Okay, very good. I must know now, probably for sure, if I
For
have
sure.
skin cancer.
Yeah. Because I have to wait at the moment, so I don't know.
Right.
I should not suffer from skin cancer.
Okay, that's a
I'm
good start.
okay.
And
Um,
Tony, you illustrate something which I think would be helpful to our viewers, and that is at B, there may be multiple demands
yeah.
irrationally, but for simplicity's sake, I suggest that you start with one and do the 3-minute exercise A, B, C, D, E, F on one, and then go
Okay.
back and when you have time, work on another one. So
Okay.
let's start with I must know for sure if I have it.
Okay.
Okay, and then we go. So A is I might have skin cancer. B, I must know for sure if I do. And then C is anxiety about that. So if you look at what we have here, although we're calling I must know for sure if I have skin cancer, we're calling that an irrational belief. But actually, it's very rational, it's very reasonable as a goal or a value or a passionate desire. So if Tony just believed, I passionately desire to know if I have it, that makes sense. Who would not strongly want to know if what their symptoms mean skin cancer? So that makes sense. But when we take our passionate desires and escalate them into demands, musts, shoulds, then we turn a reasonable preference into a very unreasonable demand. And one of the reasons it's unreasonable is obvious. It leads to anxiety. It doesn't lead to knowing. Excuse me. Okay, so we have A, B, and C, and then we go on. Any questions about A, B, or C, Tony?
No.
Okay, and then we go on to D. How do we help Tony keep his desire to know and maybe figure out some ways to find out sooner rather than later, and um, give up the must or the should about it? So the first step in doing that is going on to D. D stands for disputing or questioning the irrational belief, looking for evidence. So a good way to look for evidence for any belief is to ask why or what is the evidence for it. So if we put that at D, what would we get, Tony?
Um, well,
What question? We're looking for a question to question
yeah.
your
Well,
irrational
well, I've been told by the doctor I have to wait a week to see whether the cream will work. So, there's the dispute. I mean, I can't know right now um because I've been told to wait for a week before I contact them again. So they're asking me to try something. Um, the other
Well,
thing
we're
that
looking, Tony, we're looking for a question at D about B. And B was, I must know for sure. if I have skin cancer. So what
Okay.
question could you ask about that belief
Okay.
to see if it's a reasonable belief with evidence to support it?
Why must I know right now?
Yes, very good. Excellent.
Yep.
Why must I know, or what is the evidence I must know for sure
Okay.
that whether or not I have skin cancer?
Okay.
Does that make sense?
It does.
So if you think about it, it's really a simple process. You just take your irrational belief, I must know for sure, and put why or what is the evidence in front of it, and we get D.
So what we're saying is, what I would, even though I would prefer to know, the problem is that I must know right now. That's what's
Exactly. That's a very good summary of the problem. Even
okay.
though I prefer to know, the problem is I'm telling myself I
I must.
must know, and I
Okay.
believe I must know. So
Yeah.
you have a vicious circle there. I'm telling myself I must know, so I
Yeah.
believe I must know, and then
Yeah.
you believe you must know, so you think you must know, and then you get yourself anxious.
Yeah. Okay.
So,
Okay.
so,
Makes
so
sense.
we're
Okay.
looking for the evidence for that belief. Is it true? Does it hold any water? Is it logical and reasonable?
Okay.
So, uh, any other questions about D?
No.
Okay, very good. So we have a good question. Now we go on to the answer, and the answer is called E, effective new thinking or effective philosophy, which is just the answer to the question. And so what's the answer? Give us some evidence. We're skeptical that you must know. So give us some evidence. Prove to us. We're open-minded, though. We're open-minded skeptics. So prove to
Okay.
us that you must know because you prefer to know.
Okay. So the reason why I must know is because I don't like feeling uncomfortable not knowing.
Right.
And it
Okay,
causes,
let's start with that. So
okay,
what you're saying is that the reason you must know is because it has disadvantages not to know, right? So that's, and we could list probably 5 or 10 or 15 disadvantages of not knowing right now, but that just shows why it would be desirable to know. Those disadvantages means it would be highly desirable to know, because if you don't, then you get disadvantages. But we're asking a different question. We're not asking why would it be desirable to know. We all agree on that. We're
okay,
asking why must you have what would be desirable? And that is to know for sure. So that's the question. What's the answer to that? Why do you absolutely have to know? Where is it etched in stone? Where's the law of the universe? Where is it in the Bible, the Quran, or the Constitution that you have to know?
that's a difficult question to answer because,
Yes, it is very difficult to come up
yeah,
with an answer for that question.
yeah,
And the
because I,
reason is,
yeah.
yes, what were you say, Tony?
I was about to say I'm not God, so there's no reason why I must know and another person shouldn't know. Um, I'm not royalty. I'm a normal man. I'm not a
And also,
danger.
you're not even a doctor. You told us your doctor doesn't know yet. He's waiting a
Yeah,
week.
yeah, yeah. Yes, that's
So
true. Yeah,
you're
so
not
yeah,
royalty, you're not God, you're not even your doctor. So,
yeah, that's
so why
yeah.
should you know above all these other
When
people
no
and
one else knows.
entities? What's
Yeah.
that?
I said when no one else knows either. So I must
Right,
know something no one else knows.
right,
Uh,
right.
and that's a very good point because I can see where that's driving my anxiety because no one else knows, but I must know, and there's no possible way that I can know right now.
Exactly, exactly. Rohit, Tony, and I have been speaking nonstop. You couldn't get a word in edgewise. Is there anything you wanted to mention so far?
Yeah, I've just got some of my own ideas what Tony could use for his effective new philosophy. So he was talking about the fact that why should he know about this diagnosis? And one thing I might write if I was in that position is having to wait to know if I have a serious medical condition is a fact of life that affects millions of people. across the world. There is nothing special about me, which means I should be exempt from this reality.
Very
Yeah.
good, very good. So as Rohit is saying, I must know implies you're special, you're better than everyone else, doctors, gods, and things like that. But what's the evidence you're a special person with a capital S that should have this wisdom that no one else has? Where did that specialness come from?
That's a really good question. It's not there. I suppose that I think because I think at some level I am special and I should know these things,
Right,
but
you were
I'm not.
born special.
But I wasn't. I'd like to think I was, but I wasn't.
Right,
Don't we all?
Yeah,
right,
yeah. I think my
exactly.
mum told me I was special when I was little, but yeah,
That-
I hear you. Yeah, I hear
That's
you.
the evidence, right?
Yeah.
Okay, so you have a number of E's, effective new thoughts, but the basic philosophy underlying that is there are no musts, there are no shoulds. We just make them up in our imperfect human heads, but they don't exist in reality. Uh,
Yeah.
that's the underlying message of REBT. So when we go on to F, new feeling, once you convince yourself you don't have to know, although it would be highly desirable to know, then you're likely to feel less anxious or not anxious at all, but very concerned.
Mm.
But the hard part of this whole process is how do you get to really convincing yourself? How do you
Yeah.
get from weakly recognizing that there are no musts, no shoulds, you don't have to know, to strongly believing it, deeply feeling it, and acting on the idea that it's just preference. It's just a preference, not a real must in the world. And the answer is the bridge between level one, the superficial recognition, and level two, a deep conviction, consists of reinforcement, practice, review, going over these ideas again and again and again. And one way to do that is by writing out the 3-minute exercises on a regular basis. And you could do it on this must, I must know for sure. And I rudely cut you off when you started to come up with some other musts and shoulds. So you could do it on some of those also. But the
Sure.
main thing is going over it again and again and again.
Okay.
Practice, 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 as Albert Ellis used to like to say.
Okay.
And then as you start to see there's not a must, then you'll find your anxiety goes down because your anxiety comes from the must, comes from the demands.
Okay.
Any questions about how we did that 3-minute exercise? Did we answer your
Yeah,
questions?
you,
Simon?
you did. I think for me, the thing I found helpful in that process was when you said, we're very open-minded, try and convince us why you must know. And I think that's something that I can use when I practice again doing this on my own, to
Yeah,
imagine that I'm trying to convince someone else rather than trying to convince myself. I think that was really
right.
helpful for me.
Okay.
Um,
One way you
uh,
can use that is you can tell someone else
yeah,
that you could either talk about yourself. I have these symptoms, and I must know that whether or not I have cancer. That makes
yeah,
sense, right? And they'll agree. And then you
yeah,
can say, "Now I'm going to talk you out of that must." So
yeah.
that's one way
Okay.
you could work on it with another person. Were you going to say something else, Tony?
No, no, I was just going to say I
Yeah.
can also see where that's really helpful with lots of other situations, like most of the situations in my life, like for instance with my ex-partner, is a lot to do with my unchallenged musts about life. It's the musts really that I can see now. I can,
Right, right,
having this
very good.
conversation is
Yeah,
helping me to see the musts and the
right, right.
shoulds.
And one thing I like to say about this approach, REBT, it starts with some simple assumptions with profound ramifications, and you just illustrated that very nicely.
Okay, great. Thank you.
Okay, before we wrap it up, Rohit, did you have any final words? Oh, Rohit, you're cutting out. Hello, can anyone hear me?
I'm here.
Okay, I'm having trouble hearing Rohit. Can you hear Rohit?
No.
Okay, so let me just wrap it up. So I just want to mention to all of you to please, if you like our podcast, the REBT Advocates, please give us a like and put any comments or questions you have below this video. Support us on Patreon. And if you'd like to volunteer to discuss a problem and get some help, Tony survived, so you probably will also. So if you'd like to volunteer, let us know. You can put it in the comments or send me an email at dredelstein@3minutetherapy.com, and we're happy to have you on. Please watch us in the future. We will be having more episodes, and subscribe to the REBT Advocates to stay on the rational side of life. Thank you. Thanks.